And because there's some new people on the call, I'll just go ahead and call the meeting to order. And Brandy, why don't you go ahead and take attendance? So it's just you and I for officers because Joseph Ray is not on the call.
So Brittany, Christina, Jamie, Tiffany, Dana, and Ina.
Good, Ina Weed Hurley. Okay, great. Thank you. And then, like I said, the minutes were already approved. Leading aides, so the gal that we're working with now, I don't know if you're all aware, but so when we were in San Diego in the fall of 2019, we met with Sherry Schultz. Sherry Schultz is no longer with Leading Age. She left over the summer, and there's a lady called Yasmin Washington, and she's been on a couple of our calls, but she couldn't be on this call today unless she pops in here before we hang up. So she said she'd like to meet with some of us next week to talk about the presentation on cultural humility that we're supposed to do the end of October at the Leading Age annual meeting in October in Atlanta, Georgia. So honestly, Ina, if you and Tiffany could be on that call, I think that would be really helpful. Tammy texted me and said, or emailed me and said that I guess Leading Age now, they are requiring a COVID vaccine to attend. So Tammy will not be attending, is my understanding. But I think we still have enough presenters. But I'll have to confirm that with all the presenters and make sure they're okay with that before they, we don't want to agree to present something if we don't have enough people to present. So there's a lot of things changing around the world. I'm sure you're all aware of it. So I just want to be careful. My goal was to put the PowerPoint together in the next couple of weeks. I kind of started it, after we had those meetings. But once I get a little more of a final draft put together, then I'll bring everyone back and I want you guys to look at it and give me feedback, okay? Because they're probably going to need something by the end of September for an October meeting, would be my best guess, okay? Let me see what else is on the agenda. I'll let KAI, why don't you guys just give your update again, because Tiffany and Ina might not have heard it either.
Sure. So as I mentioned during our earlier board meeting, the September issue of the U.N.I.T.E newsletter went out earlier this week on Monday. Content for the October issue is due the last Wednesday of this month, so September 29th. I encourage everybody to submit content for that. It's very helpful. And then next Wednesday, the 22nd, is the next LTSS webinar. The topic will be NICOA's Tribal LTSS National Resource Center. So hopefully you can join.
Okay, great. Yeah, that would be good. So one thing I said on the board call is that, we had applied for those grant monies more than a year ago, and they were given to NICOA, which is fine. That was Larry Curley. So it'd be kind of interesting to see, what they've done with the money and how they've, how that looks now. I did ask Christina to send me a link to their current website, because the last time I looked, there was quite a bit under construction. So hopefully that's opened up. And then I'll send it out to all the board members so we can take a look at that. Maybe link to it from our website too. So Tori's still managing basically the website through Ron, through Native American Health Management. So we still have that connection, which is great. And then there was some follow-up, an old business from last month when Wayne Claw spoke from the Navajo Nation. And he was going to be sending us some stuff that we thought we could add on to our website, which I didn't receive anything from him, but other than a thank you, I didn't specifically ask for it either. So I'll get back with him and see if he can send me, anything he wants to send. Maybe he could even send some pictures, because I was there at his facility in person in May of 2019. And the old facility had not yet been knocked down. It was like there was a big fence around it, but now it's knocked down. It's completely knocked down. but they haven't built the native or the veterans one yet, but that's going to be the site of the new veterans one. But maybe he could send us a few pictures because it's a beautiful facility. So, and I said at the board meeting, I said I give Wayne a lot of credit because he's been at this a long time. And, he gets out and he meets with people and talks to them. And it's been a very slow, tedious process, and he's hung in there, So I give him a lot of credit for doing that all these years. Let's see. I think that's all I have. So before we get to new business, why don't we let Dana? So Dana, you have at least 20 to 30 minutes. So if you don't need the whole time, that's fine, but we're anxious to hear what you can tell us.
Oh, great. Thanks. Thanks for having me. Can you hear me okay?
Yep.
Okay, great. So Debbie, I think on Lisa's suggestion, asked me to come and talk about the Quinn QIO programs a little bit. So I don't think I have 20 minutes unless we have some questions and answers that I can help with. Okay. So a little background on me. I'm an RN by trade. I live in Anchorage, Alaska. This is Valdez behind me. And I work with Mountain Pacific Quality Health, which supports 4 states. Our region is Montana, Wyoming, Alaska, and Hawaii, which is kind of an odd mix of states geographically, but they all kind of work together. And prior to that, I was with 2 nursing homes here in Anchorage. I was the quality director for a 96-bed long-term care facility and a 50-bed transitional care. So I supported all their quality improvement activities, regulatory compliance, grievances and risk, and all those kinds of things that they kind of put into your bucket. So I've only been with Mountain Pacific since February, not very long, but I did work with Lisa in my role with the 2 nursing homes, the 2 Providence facilities that I was at. So I knew kind of what she did, and would pick her brain about, hey, that sounds like fun, and if you ever leave, let me know. And I was not ready for this, but she decided to retire, and they asked me if I'd be interested in applying. So I've done quality for years and years, and so it was very appealing to me. So the QIOs, there are 12 of them throughout the country that support various regions. We're contracted by CMS. CMS kind of has the regulatory arm, and then there's the consultative arm, and we're the consultative arm. And I'm in the nursing home group. And so I support nursing homes in Alaska and Hawaii currently. And our goal is really to support providers in providing the highest quality care to their Medicare beneficiaries. And so obviously my work is focused on homes, on skilled nursing facilities, nursing homes. And we work with many partners throughout our regions. We work with our state health departments, our hospital associations, Alzheimer's associations, AARP, anyone that really is a stakeholder in how our seniors or our Medicare beneficiaries are receiving care. And of course, currently, our huge focus is COVID, like I think everywhere in the country. And our probably the biggest chunk of time is currently spent doing outreach to folks that are experiencing outbreaks. So CMS is referring nursing homes to us if they have any 3 or more resident cases of COVID in a facility. And so we just reach out to them, see if they need any help or any support or any resources in either doing the root cause for their outbreak, or if they need education resources, or if they need help developing new plans, or just even having a new set of eyes on their policies and procedures. We're also tasked with supporting them in vaccination uptake for staff members. I'm sure you're all aware that President Biden has declared that it's going to be a mandate for healthcare. I think they've now said all healthcare facilities. I know they've said nursing homes staff will have to be vaccinated. And so there's a lot of concern about that. And so we'll be supporting nursing homes through that. Their big concern is losing staff. They've been having under some incredible pressure with staffing throughout the pandemic. Even before the pandemic, staffing nursing homes has always been a challenge. And now they're very concerned about that. So those have been, I'd say those two issues are taking up probably 70% of our time. But we also have other issues in our contract that they're wanting us to focus on. And those are things like we'll be rolling flu and pneumococcal vaccination into our vaccination efforts. We're going to be taking a look at opioid use and misuse in the nursing homes, adverse drug events, coordination of care, such as ER visits and 30-day readmissions. We'll be looking at those and other infection control issues like C. diff. So we can provide education, we can provide resources, we can come in and visit and take a look around, we can do audits, we can provide regulatory support. We do a lot of explanations for the quality measures that nursing homes report and that come through CMS, help people understand that. Then we also have community coalitions, and I'm not as involved with those, but those are more focused on the community and acute care side. I know there's focus on coordination of care on their side. They also have other chronic diseases that they're focusing on. So they'll support primary care providers, hospitals, other community partners in kind of assessing what their community needs are and helping them work through best processes, best practices for supporting all those populations and those issues. And so that in a very fast nutshell is what we do. You can find your QIO at, I think I sent Debbie the link. It's quinqio.cms, I think. I'll find that. I can stick that in the chat, but if folks are interested in who their QIO is and want to reach out to them, it's pretty easy to find through CMS, that QIO program. So any questions I have?
Hey, does anyone, I do have some, but I'll wait if anyone else, does anyone have any questions they'd like to address? Anyone? Okay. So, I mean, I guess I do. So I worked for a Quinn QIO. I worked for a Health Service Advisory Group. Lisa might have told you that in 2019. So when they reassigned all the states and Arizona, you know, we lost HSAG Health Service Advisory Group, lost, we kept California and Arizona, but we lost Ohio, Florida, and the US Virgin Islands. So I was laid off that job in November of 2019. Do you anticipate more reductions like that, or have you heard anything? Are they going to shift states around, make any changes that way?
No, I haven't. In our next scope of work is fairly intense. So I don't, and it's still in negotiations, but we're actually looking to add staff in ours, and I have not heard anything. I have heard about the previous, I've been with Mountain Pacific since February. So so I've heard that they kind of tend to go through these cycles, but no, I haven't. They're kind of increasing what they want us to do. So I have.
Could you explain to everyone what a scope of work is under a contract with CMS, how that works?
Yeah. Well, I'm learning it myself, but since I said we're contracted with Medicare, so they have specific targets and deliverables that they want us to achieve, and certain targets they want to hit. For example, they're looking at a decrease in 30-day readmissions to hospital to decrease by 9% for long-term care residents. So they'll set goals and targets for us. And we're still working out what those might be, because they may want something that we don't think is achievable. So we kind of have to go back and forth until we, land on what we feel is appropriate on both sides. Again, I haven't been through this process before, but that's what I'm seeing happen currently. So I'm not sure when we're gonna see the final draft of what that scope of work and that contract is going to look like and what all those measures are going to be that they want to see us attain. But I believe it'll be in the next month or two, with, like I say, a heavy emphasis on COVID, and then some other measures.
Okay, and that the CMS under these Quinn QIOs works directly with the National Quality Forum, correct? NQF, is that right? Do you know?
It works directly with them for,
Like I know that when I worked at Health Service Advisory Group, some of our upper echelon folks would go to the NQF, you know, the annual meetings and things like that. Is that correct?
possibly. That's not something, you know, since there hasn't been any travel lately,
Okay.
you know,
Okay.
since I've been on board, I know they do attend a national conference of the QIOs, and that may be it, but nobody's doing it this year, so it hasn't really come up.
Okay, and then I have another question on the quality measures. So during 2020, my understanding is a lot of the quarterly, and maybe Tiffany, you can address that. Wasn't there some times where you didn't have to report your quality measures? Because in 2019, I went to training at CDC for the, you know, NHS or NHSN, you know, National Health Safety Network. And then the big thing in July of 2019 was C. diff. And then all of a sudden it was just like, no one even cared about C. diff and it wasn't even being reported. So is that like, I know you're new, I get that, but like, is that not back on the radar screen? Will it ever be back on the radar
Yeah,
screen?
it is. Yeah, C. diff is, they're going to be looking at hospitalizations due to C. diff going forward. But like I say, since I've been on, the whole focus has been COVID.
Was there ever, maybe Tiffany could respond to this, was there ever a quarter, or Brandy, where you did not have to report your quality measures to CMS? Or
It may
if you,
be, I know there were various waivers early on that addressed, you know, what they were going to be looking at. The homes I worked at didn't report. You know, we only did the MDS measures, which
okay,
are the ones that
okay,
feed the 5-star.
right, right. Okay, I know that not, it depends if you have to be receiving Medicare and Medicaid funding, right? In order
Mhm.
to, you have to do that and report those measures to get your Medicare and Medicaid funding, correct?
Your MDS, yeah, you're reporting
Yeah,
your MDS.
yeah.
Mhm.
Right. Okay, does anyone have any other questions for?
This is Brandy. I think with the COVID, we didn't have to do those quality measures like in a timely manner, like they would make us do them every month, but we still had to catch up with that eventually.
Oh,
So
you
it's
did.
almost easier to make sure you got them done instead of waiting for a long period of time. So that's
Yeah.
what our thoughts were on that.
Okay, okay.
They did give us a
Okay.
waiver where if we were late, depending on what was going on at the facility, you could put them in at a later time, but you still had to do those quality measures regardless.
Okay.
They are
Mhm.
currently having to report weekly their COVID numbers and their vaccination numbers, along with supply resources and staffing resources. They have to do that weekly currently for COVID specifically. And
Into NHSN, into
Yes.
NHSN.
Yeah.
This is Brandy, and yes, we do have to. Some facilities, I mean, it's almost better to report it more than once a week.
Yeah.
But you have to do your vaccinations, your how many COVID tests you're doing on a weekly, your supplies. If you have staffing issues, and that's on a weekly basis, so you have to keep track of that weekly.
Yeah.
Besides, other than all of the rest of everything that we report to also.
Right. Yeah. And we get referred weekly if somebody has missed reporting or they've got some vaccination thresholds, they'll refer homes to us if they don't meet, which is currently 50% for staff vaccination. If they're lower than that, we get a referral to check in and see if we can support vaccination.
And when you say vaccination, that's only for COVID.
COVID.
That's not like
Staph COVID,
influenza.
right? Not
Okay.
at this time, no.
It's flu and COVID. We do have to report flu also if we it's right in the NHSN. So I do the
Oh, it
report.
is.
Yeah. And it
I was
asks
just saying we're not being referred for flu. We're being referred just for COVID.
yeah, so
Yeah.
they do ask for the flu and the COVID vaccination. And of course, they're asking for the booster now too. So that's all part of the reporting.
Is that on NHSN, the booster, or just?
Yep. It's reporting it. It's not on there, but I mean, if we've had any residents or staff that have had to have the booster, which we have, then we have to report that also on a weekly basis.
Into NHSN?
Yep.
Oh, so they actually have like a place to put it when you log in.
Yep. Well, they ask questions, and you just have to go through and answer all of the questions on a weekly basis. And if you
Okay.
don't answer them on a weekly basis, you get fined. So you have no choice but to answer.
Okay. And I know, I don't mean to, put you on the spot or anything. But working at HSAG as a QAO, I know that like there's the enforcement piece and then there's the, what you're doing, which is coming in and just basically educating and whatnot. But I had a question on like the National Consumer Voice early on, not that long ago, a couple months ago, had some serious concerns, about violation of resident rights with people, being told they couldn't come out of their rooms and all that kind of stuff. Is anyone addressing that? Do you see that coming up on some of these, maybe looking at that in terms of a quality measure? Do you see that being looked at all?
Not in terms of a quality measure, I don't. There's lots of talk about it, at the nursing home level. It's been a concern all along. I haven't heard of anybody being cited by following the guidance for visitation. The guidance does state that, so there are visits called compassionate care visits that often they'll use if somebody's at end of life, and there's guidance on how to conduct those. But there's also an expanded definition of a compassionate care visit, which includes if somebody's having trouble adjusting, or if they're losing weight, or they're exhibiting signs and symptoms of depression. That kind of expands that ability to allow visitors in. But we have to follow that when there's a mandate regarding visitation, they have to follow that, unfortunately. Like I say, now that people are vaccinated, things have opened up significantly, but it's still sometimes, I have to know where my state surveyors are going to land on the side of am I allowing too much or not enough visitation?
So in your states, you're saying you haven't seen any citations, though, if there was a breach in a guidance for
No,
visitation?
not for resident rights. I haven't heard any for resident rights.
Okay, but there may be for infection control, perhaps.
Exactly, yes.
Okay. Okay, and then my last question for you, and I sent this link out to the board. It was on YouTube. I'm sure some of you are aware of Project Veritas. They do investigative journalism. And there was a story that broke this week about Aegis that owns a lot of nursing homes or assisted living and memory care units, with some pretty significant concerns. Some whistleblowers that work there came out and we're talking about like people being sedated and then being told they were given the flu vaccine when in fact they were being given the COVID shot.
Oh, no.
And some different, it was and so, Aegis is kind of shut down and not talking, although the whistleblowers were pretty vocal, and some of them were, I'm not sure if they were CNAs or nurses. I listened to the YouTube video, I forwarded it to the board. I just wondered if, I meant to ask Dr. Brune, but now he's not on the call. I wanted to have him address that because he's, you know, now a board member with AMDA, they certainly must be aware of that. I mean, are you hearing of any other stories like that, of concerns where, you know, because of the mandates, that people feel backed into a corner and they're maybe doing things they wouldn't normally do in normal times?
No, what I'm hearing, no, I've never heard anything like that. There's, we've talked to lots of homes that really don't have they have 20, 30% maybe of folks vaccinated, and they're not of residents, oddly. So I don't know where the disconnect in the community is between it's okay to vaccinate, your loved one in the home, but you're not going to take it. But that's a story for another day. But no, their concern is that people are going to leave. That is far and away the concern that we've heard, is that that they're going to lose staff because it's been mandated. But I have not heard of any kind of strange workarounds or anything like that at all.
Is there I mean, because with the population, I mean, I know the amount of residents is probably down in some of these homes, but even still, I mean, these are people that can't just be, put back in their home and hope everything goes okay. Is there any kind of emergency preparedness plan at a federal level going on to consider what's going to happen to these people in a month or two from now if 50% of long-term care workers leave? I mean, is there any kind of, are nursing homes being told to look at their emergency preparedness plan? I mean, you don't like to think this is ever going to happen. You like to think it's going to be, something like a natural disaster. But if you lost 50% of your staff tomorrow, you might what would you do with those folks that are laying in those beds?
Well, having an emergency preparedness plan has been a regulation for them now for several years. And they have been coming in and looking. So the facility, the part of the mandate, or under the emergency order, they've been coming in and doing infection control focused surveys on every home initially, and then anybody who's experiencing an outbreak. And one of the things they're doing is taking a look at homes emergency plans. And one of the sections that they need to have in there is contingency staffing, but it's a real challenge because they're not the only ones that are experiencing staff loss. I mean, I think people are leaving the industry in droves. I think hospitals are in the same boat. I think in places like Alaska and Hawaii, where I support, it's really, really hard to recruit people. You only have a limited pool where you're actually at, and then it's probably easier to convince somebody to move to Hawaii than it is to move to Alaska. But it's a real challenge. But I'm hearing that in the other states that we support as well. And so, yeah, they do have emergency plans, but sometimes there's only so far, having the plan doesn't mean that you're always going to have the resources needed to implement that plan. I know folks have reached out to Red Cross early on for support and staffing. If they're lucky to be able to work with a CAW or a hospital, you might be able to get coverage there. But again, they don't want people going back and forth between facilities if you're doing a long-term care. So they're really kind of in a rock and a hard place. They have done, at least I know at the state level in Alaska, and I believe federally, they did an emergency CNA, sort of temporary CNA measure where people can get a brief, I think it's 6 or 8 weeks of training and then go function as a CNA with certain tasks. And then there's a track for them to get certified later on. So they've tried to make it a little bit easier for people to come in as a CNA, but it's not like people have never flocked to nursing homes to work. And so, it's just even that much more difficult now.
Mm-hmm. That's a good answer. I mean, there's a lot unknown in moving forward. I did get, for those of you on the call, I did get a text from Tammy, who's in Wyoming, Fort Washakie, Wyoming. And she did say that hospitals are now paying $250 an hour for nurses in Wyoming and Idaho.
Wow.
Skilled nursing facilities can't compete with that.
No.
Hospital in Cheyenne is now offering a $10,000 sign-on bonus for a CNA.
Yeah.
Had you heard of any of those stories?
Yeah, I have heard. I haven't heard of $250 an hour. But I have heard of folks offering large bonuses for vaccination, even bonuses for staff coming on. And I'm curious, I haven't heard how successful they've been, though. Interesting to
That
keep
would
an
be
eye
an
on.
interesting like study, you know, to kind of track. I mean, overall nationally, do you know what I mean, maybe Tiffany knows or Brandy knows, like if you look at all nursing homes across the country, how occupied are they? Are they like at 50% capacity, or are they at 100% capacity?
They're not at 100. I think they're probably operating around maybe 60 on average.
That's what I was gonna say. This Brandy, I would say probably around 60 to maybe 75%, but I haven't heard of any facilities that are fully have a full capacity.
I mean, you have to stop admissions if you have an outbreak. So, you know, they're kind of start and stop as far as admissions go. Some I know are requiring residents to be vaccinated before they come in. Some aren't.
Are they still quarantining? What's happening with quarantining? Oh,
You mean in the facility?
yeah, like, you know how early on if they went out or came back or whatever.
Yeah. They have to, I think the guidance currently states if they've gone out, that they need to be tested and monitored for symptoms when they come in. They are being quarantined if they have symptoms or if they test positive. A lot of homes have COVID wings now, where they have, you know, their own entrances and exits. They're cohorting folks in that area if they test positive. They'll have maybe an exposure wing. So you may have your known positives, but then you may have those who have a significant exposure that you're monitoring. They may be in a yellow zone. But yeah, they are being quarantined depending on if they've got symptoms or what their testing status is.
So here's
I
another
have a
question.
Oh,
Go ahead,
sorry.
Tiffany. Yeah.
So my question is, what we require them to be COVID tested before they come in, but I didn't know we could require a resident to be COVID vaccinated. So that's
I know
something
some
new.
homes are, yeah.
Oh, okay.
Mhm.
All right, I might have to look into that. Okay, thanks.
I mean, so my other question is, you know, say 5 years ago, right? You have a C. diff outbreak or whatever, and you cohort people because of C. diff. I mean, so let's say now you've got these separate units for COVID, but there's still other infections obviously going on. So what if you have 3 COVID cases and 3 C. diff cases? I mean, how does that work strategically, or, you know, in a facility when you got multiple infections and multiple, you know, potentially multiple things going on at the same time? How does that work?
Well, the good news is I think across the board, other healthcare acquired infections have been down since COVID, with the increased focus on PPE and that. I think that since COVID's airborne, that gives it a different kind of a different approach than C. diff, for example. I would assume that someone would be contained to their room with a C. diff outbreak, but they might not necessarily go to the COVID unit because they're very concerned about the airborne quality of COVID. I haven't talked to anybody that's had C. diff outbreaks. We didn't have much C. diff at all in the homes that I was working in. But what we would have done in that case is put them on their transmission-based precautions in their room, or we had specific C. diff precautions because of the different cleaning that was required and things like that. So they would be isolated to their room just as they would have in any other year without COVID. But COVID would still be handled differently.
And that's a really interesting comment you just made, that other healthcare acquired infections have been down, because I was on the state of Arizona's subcommittee for healthcare acquired infections in 2019 and did a couple of statewide presentations on that topic. Do you have any data to support what you just said? Could you send me that? Because I'd be really
Sure.
curious to look at that. And I know the QAOs have tons of great information that you guys get. I'd like to look at that. I'd like to see, you know, what you're talking about with norovirus, MRSA, you know, C. diff, anything. I'd like to see those numbers. That's a really interesting comment that you just made. All right, anybody else? Thank you so much. I think it's wonderful that you were here. If you have a supervisor and you want to send me their email, I'd be happy to send a glowing report of the work you did today.
No.
Because I know that always helps when you get, you know, when your supervisor gets someone saying, thank you, thank you, thank you. So, you know, we appreciate Lisa and we definitely appreciate you. So, all right, thank you so much. I'll do a little follow-up. And then let's see if there's anything else, any new business, anyone want to bring something up in the last about 15 minutes that we have? Ron will be sending the financials. He did not have those at our earlier meeting. Anyone have anything on member outreach, outreach to tribes, tribal consultations you've been on, any new business or any updates that we should know about? Anybody? All right, Christina, anything last minute? We do have a Google Drive. I think we should send that link out once more, Christina, to everybody. Save it to your bookmarks. And then if you want to share something on a Google Drive, on our Google Drive for U.N.I.T.E, can we all do that or just me? Is it just me?
I'm not sure. I have to double check. I believe it was
Okay.
set up so the board members had
Yeah.
access.
Okay. Yeah, so if you're a board member and you're on this call, I think you have access to that. But maybe Christina, when you send that, you were going to do something else.
Sorry, I missed the last part of what you said.
You were going to send something else out. I forget what that was.
You asked for the link to the NICOA.
Yeah, NICOA. So when
resource
you
center,
send that out, send the link to the Google Drive out, and anyone that's on the board, you can just save that to your bookmarks, and then you can just go in there and drag something in there if you want to share it. It's okay. Because there's sometimes you're just out and about on the internet and you find something really good, a web, you know, information. And we'll look forward, Dana, to seeing that some of that statistics on healthcare acquired infections. That would be super helpful. And then I'll follow up with Wayne Claw and Dr. Brune. So, okay, thank you all for being on today's call. We'll look to be on the LTSS webinar is next Wednesday, the 22nd, and that's 3 o'clock Eastern or 2 o'clock? 2 o'clock.
Let me double check really quick
Okay.
before I give you the wrong information, because I
Sure.
always have a conflict and so I can never join.
All right.
I have 11 o'clock Pacific, so 2
Yeah,
o'clock.
so 2 p.m. Eastern. So we'll try to be on that, and then we'll also probably have a call next week. And Tiffany and Brandy, I'll try to get you both invited for sure, and Ina for the cultural humility, because we're going to need to go over our presentation a little bit with Leading Age and talk about the annual meeting. So do you think KAI needs to be on that call or not necessarily, Christina?
Remind me which call this is? Sorry, I was
So
double
with
checking the calendar.
Leading Age, just to kind of talk about the annual meeting with Leading Age, do you guys want to be on that call, or do you think? I mean, what I'm thinking I'm going to have to do is once I get the PowerPoint put together like I normally do, I'm going to send it to you guys to add the CMS trappings. You know how you put that stuff around the edges? It'll just make it look more official when we're presenting at Leading Age, I think.
We could send you the template or the PowerPoint
Okay.
from July.
Yeah, if you want to do that, then I'll start adding stuff on that, and then we can work right off of that.
Okay, yeah, I'm not able to join the call
Okay.
with Leading Age, but it sounds like you have everything under control, so I think you're good.
Well, you're too kind. If you could see my house, you wouldn't say that. All right. Well, thank you all, and have a really good rest of your day. And our next, okay, let's see, October. Whoa. So our next U.N.I.T.E call is October, it's a little later on the 21st. October 21st, which is a Thursday, okay? And that's good timing because that'll be right before the annual meeting, so. With leading age. All right. Thank you all.
Thank you.
Okay, bye-bye.
Bye.